Okay. I think I'm going to say the question and then answer it. Okay. What is your recommendation for functional medicine approach to pain and autoimmune reactions? LDN, other supplements, herbs. There's lots. Okay. First off, remember, if you're going after autoimmune reactions, okay, that is the immune system going a bit wild. So you want to calm down the immune system. There's several things you can do. Number one, all the functional reasons, all the functional stuff, meaning fix the cells, fix the gut, and so forth. Look for the root causes. Okay. There's something called PEA, which is palmitoethanolamide, okay, which works very, very well as an anti-inflammatory. LDN works very well. Okay. But there are people out there that don't do well with LDN or don't do well with something else. They're just options. Okay. So you want to bring down the immune overreaction using something else. Which supplements are used to address anxiety and depression? Tracy, same thing. The reason for it. Okay. Generally speaking, anxiety and depression can be almost anything. Okay. You can use what I do is in my history, I'll say, gee, what's worked for you before? And even if they took a medicine for a little while and it worked for a little while and didn't work anymore. So let's say it was an SSRI. I know I have to raise serotonin. If they were taking benzos, but got off the benzos because they're addictive quality, I know that I have to raise GABA. Okay. It's not a one-off thing. You have to investigate a little bit. I see your diagram NTH4 has a relationship to copper. 3 people in my family have low copper supplementation. How would you understand that, and what would you do about it? There is, if you're in the United States, Ulta Labs has a set of a panel called the Full Monty. I know, funny. Okay, but it includes everything in there, like ceruloplasmin, copper, magnesium, and so forth. So you can follow the root cause protocol, okay, to balance off the copper, okay? And if they have low copper despite supplementation, the supplementation is not getting through. So we would have to talk about different ways of getting copper. There's one thing I can think of is made by FIQ, and it's called, oh my God, Repair IQ or something to that effect. And has a bioavailable form of copper that seems to work very well. Would you chelate lead? Would you chelate lead that was high in a challenge test? Would I chelate lead that was high in a challenge test? Well, I tell you, if I see high lead in anything, I'm going to start treating it. Okay. In a challenge test, I don't like challenge tests. I'll tell you why. Because when you give somebody a chelating agent, sometimes you release a lot of heavy metals, and yes, you get your answer, but now they're running around where they were stored somewhere relatively safe. Okay. You've now released them and you've opened Pandora's box. You let Godzilla out. Okay. And I've seen a lot of kids crash upon getting, the challenge test done. So I realize that is a tough thing to answer. I will chelate lead. Okay. There's lots of ways to do it, but I also look at all the other, trace minerals and heavy metals. If you don't know what to do, start applying them with trace minerals. I think Quicksilver Scientific has Amalclear, AMALG Clear, which is a safe way of doing it. Okay. And of course you could use parsley or I forget the other herb to help you gently chelate, to pull things out slowly. Okay. It is important. Lead is one of the nastier things for the brain, but aluminum and mercury is even worse. What if you have COMT or other SNPs that make you sensitive to methyl donors? Well, a lot of people are sensitive to methyl donors. As a matter of fact, I never use them, okay, because almost all my patients are sensitive to them. So when you say methyl donors, you're thinking giving somebody methylfolate or methylcobalamin. Again, I never use them. Why? Number one, a lot of my patients are sensitive to it. 2, if I give somebody 5-methylfolate or methylcobalamin, what am I doing? I'm not fixing the pathway. I'm giving them the result of the pathway. And if that's all I do, okay, guess what? I'm not fixing them. So for folate, I use a natural folate. Okay. And it is available on Amazon. Forget the name of it. Just look up natural liquid folate. And it's a company that's woman owned, and it's made for pregnant women. It's made from lemon peel. For cobalamins, I tend to use hydroxycobalamin or adenosylcobalamin, and I basically find out which one they can tolerate. Okay. And I don't necessarily need to use SAMe most of the time. Okay. Because as I'm fixing the pathways, giving their bodies what they need to work. Okay. The real trick here is to give the body what it needs to work and get out of the way. Do not micromanage. Okay. Give the body what it needs, even around it, even if you avoid that area. Okay. It'll start working again. A lot of this stuff has to do with leaky gut, by the way. What if 5-HTP causes excitation? Well, I've seen that before. Okay. It's not an absolute that the tryptophan will go down the IDO pathway. All right. It's not an absolute. So when somebody has not been able to stand the 5-HTP, number one, I'll stop. I'll use powder, 5-HTP powder. That comes off Amazon also. And I'll start with a quarter of a scoop. Why? Because sometimes with any of these substances, it's the fillers and stuff that are in the capsule. So to rule that out, I may use small amounts of 5-HTP. And if I can't, and I know the person needs serotonin for whatever reason, I'll go back to using tryptophan and just keep an eye on things. Okay. When I treat somebody, I'm talking to them weekly. Okay. I don't give them a treatment plan and say, I'll see you in 3 months. Okay. I talk to them a lot. All right. I'm in their life pretty deep. Okay. And that's why I'm very, very successful in getting people better. If they work with me, and I promise to walk the road with them, and I do. How do you increase GABA and serotonin? Well, serotonin, like I said, you could use either 5-HTP or tryptophan, plus all the cofactors that you've seen. All right. GABA is a little bit more problematic without giving GABA. All right. And that would be more the, you would need glutamine, or at least enough B6 for that pathway to work. And you can try small amounts of glutamine. That will help create GABA. Those are just some of the things you can do. How do you like to test and treat mold? Well, there's another 2-hour lecture for you. Okay. Testing mold. Most companies, Great Plains and so forth, have a test for mold in the body. In a house, I do the easy thing. I go to Amazon, I get the mold test kit. It's a little Petri dish. It costs about $9. Okay. And I'll get 2 or 3 of them, and have my patient put the fluid in the, just follow the instructions, and have one Petri dish in, let's say, 2 or 3 rooms. Then I have them cover it, wait 2-3 days. I don't have them send it to a lab. Okay. And then just take pictures of it. If I see 15 or 20 mold colonies, they got a mold problem. Okay. Then we can start investigating where. Okay. Because it doesn't matter what you do for mold for the body. If you don't get rid of the source, you're never going to get better. Some of the things you can do, if you're in the United States, it's a little easier. You can find this thing called a mold bomb that's made from Biocide Labs. And I've used it before. Set it off in my basement, goes in between the walls, kills all the mold. The other thing you can use is something called concrobium, which you can get at Home Depot. You can also rent the fogger. And I believe this stuff is organic enough that you could drink. It will get the mold. It will dry it out. It will put a coating over it. Okay. And you'll probably see a difference within a day. If it comes back, you know that you've got a problem that needs to be fixed. How do I treat mold? Loads of different ways, but basically, okay, binders, glutathione, and whatever else they might need to support their systems. And that's getting super basic and quick, because boy, am I over time. Okay. I hope you guys learned something. Okay. I hope I didn't talk too fast. And I hope it was something that was useful for everyone. Okay. I sincerely want to, share my knowledge with you. Okay. If you're in England, I'm going to be at the IHCAN conference in the beginning of September, lecturing. And if you have any questions, I look forward to hearing from you.